Well, when my husband and I returned to Indiana a couple years ago, when we retired, we decided to live in Brown County, in Nashville, beautiful hills of Brown County. And I started to pay attention to what was going on in the State House. And what I saw was a totally captured supermajority, Republican supermajority. And when they have a supermajority, as you know, that party doesn't have to interact or listen to the other party at all. And that makes for terrible policy. And so I stepped up because nobody else did. I like to frame myself as a ticked off grandma. And so some of the things that I'm fighting for are for my grandchildren, so they'll have a better quality of life. And I just don't see that happening in the State House right now, because I think they're captured by the big moneyed interests, and I think that needs to change. I'm qualified because I care. I'm educated. I know a lot about public health as a registered nurse and a public health professional. And I think we need more medical personnel and legislators in the State House right now so that we can prevent what's happened with the pandemic from happening again. Because what happened really didn't need to happen. Other countries and states have supported their workers and their businesses. They didn't have to all close. Workers didn't have to lose their job. And our public health department was not prepared. Our public health department should have been able to step up and handle this with the testing and the contact tracing. And they've been underfunded for years. And so I think that's why I'm qualified. I know from working at CDC what a public health structure should look like, a strong public health structure, and I'd like to bring that to the State House. The top issues that I hear about all the time are public schools, affordable health care for everybody, and protection of our environment. I support health care for all. I think this pandemic has shown us that linking your health care to your job is a really super bad idea. I think healthcare needs to be uncoupled from jobs. And I think there's a lot we can do with the Medicaid. I know the Medicaid's already been expanded a bit, but I think we can expand it more with Healthy Indiana and cover a lot more people. I support expanding Medicaid up to 400% of the federal poverty limit. And I think that would cover just a whole lot of people in Indiana. Public schools, there's a huge issue with public schools in Indiana. And I think we need to have a moratorium on vouchers. I think we need to rethink the school funding formula, protecting the environment. We all want clean air, clean water. We want corporations not to be able to dump toxins on our land and leave them there and take off. I'm running because I want my grandchildren to have a better future. So we want that environment to be clean for them. Also, we need to have a coordinated approach to climate change. As we see with the hurricanes and the fires, the droughts, which we're in right now, we really need to coordinate better nationally and the state and with the locals and what we could do to address global warming and climate change, because at the end of the day, if we don't address that, it doesn't matter if people have health care. It doesn't matter if businesses want to come here, because the environment won't be suitable for life. Well, I think getting on those committees that represent those priorities would be my top focus. And working with the professionals in the community, working with the business community, working with the public health community, and find out where we stand on Medicaid, and get all the decisions that are made should be data-based decisions. And so I think it's getting the different groups together to discuss how to move forward, but not to give in to the big moneyed interest that want it to go a certain way, and to really be more about what's the best for the people. What do the people want? So I agree with Woody Myers, Linda Lawson, that it really should be about people over profits and people over politics.